Hi, welcome to my channel. I'm Dr. Varudhini Kankipati. Have you been experiencing feeling low, fatigue, not really interested in doing things? You have a lot of work, you just barely get that work done, and once you come home, you don't want to do anything? Well, if these are some of the things you're experiencing, please continue to listen, because there's one area of depression that does not really get talked about, which is called Persistent Depressive Disorder, also formerly called as Dysthymia. And a lot of people who have high functioning depression have what we call as Persistent Depressive Disorder. So Persistent Depressive Disorder is a type of depression that is disguised. It's mostly a form of depression that people are not aware of. They camouflage it, they act like everything's okay. So if you have been noticing other people, they're all functioning very well, they're taking care of everything, but later on they come to you and tell you that they were feeling depressed, you might be really surprised. You're like, that person gave no sign of depression. That's because persistent depressive disorder is one that does not get recognized easily, and it's disguised. One does not even know that they might be having depression. So what are some of the symptoms of PDD? The first thing is that it's a low grade of mood, sadness, void, numbness that's persisting for years. It's not 2 months, it's not a month or week, it's actually years. And you know that you are feeling not completely energized. You don't know why you're feeling lethargic or have inertia. And you might even sum that up to be laziness, but it isn't that. Why we call persistent depressive disorder also as high functioning depression is because you're functioning. If you've been diagnosed as having clinical depression, then you clearly know that you are not functioning optimally, meaning that you're not able to get your tasks done. But if you have persistent depressive disorder, the most likely thing is that you're doing all of those basic things, you're able to work, and therefore you're like, well, okay, I'm getting it done. You tick mark all the tasks that you have to get done for the day, but you know that you're not feeling that great. So PDD and major depressive disorder are both very related, but they are different in severity. Major depressive disorder, the symptoms are more severe, but in persistent depressive disorder, it's not as severe. And I'll give a small example. So in major depressive disorder, find it very hard to get out of bed. Can't get out of bed. It's a struggle. But for persistent depressive disorder, it's a struggle, but they're able to get out of bed. So that's the range of intensity that I'm kind of talking about. And if you realize that your sleep is off, you're either sleeping too much or have insomnia, if you're overeating or do not have an appetite, if you are working and getting all your tasks done, but you feel so exhausted once you finish it that after you come home, you just want to crash or not do anything. You don't really feel like getting involved in other extracurricular activities. You only do what you have to do to survive. So your motivation comes from just barely getting things done. If you know that that's what you're doing, talk a little bit more to yourself and see, okay, am I also feeling low? Am I feeling this type of a void? It feels like an empty vacuum feeling. This type of depression is not always about sadness. It can feel like a heaviness in the chest. It can feel like a numbness, and like I was saying before, a void. Another thing is that you're feeling very hopeless. You feel like, okay, nothing's, and helpless. It's like, what's the point? You don't feel like there's a lot of meaning to the things you're doing. You do it because you have to do it. And if you had a choice, you wouldn't do it. So these are some of the symptoms that are for persistent depressive disorder. If you have any of these things, there's also the manifestation, physical manifestation of this, which is that you could feel this form of headaches, and you feel like you're physically not well. You feel heavy in your body all the time. So if these are also some of the things you are feeling, the first thing you need to do is get your vitals checked up. Like, for example, your thyroid, your vitamins, your B12 levels. Get all of those checked, because they are related to your mood. Second is go to a counselor to get yourself evaluated to see if maybe you are falling into PDD, and the counselor will help direct all of this. The third is you need to be able to regularize your sleep and get more sleep. So a couple of things with persistent depressive disorder. As I mentioned earlier, some of those symptoms that we were talking about, sadness, fatigue, and all of that. What's unique about this type of depression is that, one, it's more than 2 years. Second, in the period of the 2 years, there is no mania or hypomania that happens. Third is that even if you have a break from the depressive episode, the feeling of normalcy is not for more than 2 months. Now, if there is a break in that and it's just random, here and there, it won't fall under persistent depressive episode. It's called persistent for a reason, because it's persistently there for 2 years with no break longer than 2 months. No hypomania or mania takes place over that period of time. So if you feel like any of these things are resonating with you, first thing is, please go consult a therapist who will help you to really understand what type of depression, if you have depression, what type of depression you have. And it is very easily treatable to make you feel better. One thing people don't realize with persistent depressive disorder is that it is like a temperature rising. It just keeps on getting worse before you really find that you're too overwhelmed and can't get anything done. So before you get there, if all of these that we have been talking about resonate with you, let's just go get help. I hope this video feels like you've got some information regarding one form of depression. And if you do feel like you're experiencing something, please remember it's actually very, very common to be experiencing this, and there is help and support out there for you. You're not alone. Thank you so much for joining me. I do hope that you like, share, and subscribe, and I will talk to you and see you guys soon. Take care. Bye.